COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, Bridges Over Barriers community. I am extremely excited to talk to the Executive Director of Brittania Woods, Faduma Yusuf. And before that, I just want to formally tell you guys about our current fundraiser, 5K for 5K. And the main reason I'm talking to Faduma today is we want to be able to provide our underserved community, our underserved kids with an active summer. And so we're actively started this fundraiser to be able to provide the kids with what they need. The camps, balls, whatever they may need to be able to be active, because not everybody can afford that $225 camp per week, right? And these communities often have been, unfortunately, the hardest hit when it comes to COVID and COVID response. So this is us trying to do our part. What we ask for people is to show clips of them doing 5K of any activity: run, bike, unicycle, cartwheel. My boys, I think we're going to be stick handling this weekend for 5K. It's going to be wicked. And let's not forget PK Subban jersey. We have the auction that we got to set up. The PK Subban Foundation was so kind to donate a signed jersey by the one and only PK Subban. So we'll be auctioning that off to try and raise some funds. So thank you so much for joining. And Faduma, welcome to the Quadcast Nation.
Thank you so much, Kwadwo and Quadcast Nation. Thank you for having me.
Absolutely. I am really excited. You and I have had many chats offline. And by the way, if anyone has seen her CBC Ottawa interview, I was in my car. I never told you this, but I was in my car and I was just like, yeah, you represent, talk about Brittania Woods and the underserved communities and COVID. I was so proud because it was a message that wasn't being portrayed enough in the media as far as I was concerned. But okay, so maybe I'm just being a little bit too excited. Let's start with your job. So you're the Executive Director of Brittania Woods. Tell me about this. What do you see at ground level? How did you get involved in Brittania Woods?
First of all, thank you guys for doing this campaign and shining light on a summer. It's exciting seeing everything open up, but we have to remember everything is slow, and there's a lot of needs that need to be attended to. So thank you for everyone who's participating in this fundraiser. Really appreciate you all. So Brittania Woods has a special place in my heart. It's where I called home for more than 15 years. And I'm blessed to be back in my career working here at the community house. So the community house is essentially another home in the neighborhood. And what we focus on is offering a lot of engagement opportunities for children and youth, after school programming, homework clubs, youth outreach. It's a space for the kids, for the parents. We work on key issues in the neighborhood as well. And our focus is really to address the unaddressed issues due to massive issues of poverty in our nation, right? It's a trickle-down effect, but our focus is on providing really good programming, accessible programming, and engaging children and youth with opportunities directly in their neighborhood. We also do an emergency food bank So we have emergency food available, which has been a priority for us during COVID. And we serve a lot of people outside of Brittania Woods. And we also do we're doing a lot more specialized mental health supports for Black and racialized individuals, particularly adapted to the needs that we're seeing in the neighborhood. So we do a lot, but that's the nimbleness of community houses. There's 15 of them across the city, and they're all found either in or very close to social housing neighborhoods.
That is incredible.
Yeah.
And I know it goes without saying, but just thank you for the work that you do for our youth. I think this is something that, especially in light of what's been going on now, is so admirable. So thank you. One thing I want to get from you is how the COVID has affected, not only, like, I think we've talked about how COVID has hit your community hard, but how has it affected, like, the school closures and the inability for people to have these activities? How's that impacted your community?
I started during the pandemic, right at the onset. I accepted the job. Actually, no, the job. No, I started, but it's been a pandemic ever since. So the heart of what we do is an open space for children and youth to come in and have a safe place to be, get help with homework, get help with anything that's going on within their lives, be a first point of contact. We have a small space, and we also rely on school facilities to do our programming. We were seeing up to 60 kids a week offering homework help, healthy snacks directly in our neighborhood school. We weren't able to do that anymore. School is one part of a child's social life, but so is after school programming. And we prided ourselves in remaining accessible, available, and functioning with very little resources, doing the best that we can. And we have been able to see a lot of engage a lot of kids. So we weren't able to do any of that. And that's been extremely difficult. It's what fills me up in my work. So it's been hard not to have a space for children to come in and just be kids and help them with homework, help them with whatever's going on, and be that safe place. But it's also hitting them extremely hard. Virtual school is a thing that no one was used to, and going into that right away, households were not prepared. I think, I know, Kwadwo, you talked about that quite a lot. A lot of doctors have talked about that. A lot of activists have talked about that. A lot of families were not prepared. And, as we dragged on through the pandemic, it's just kind of continued. I think parents are surviving. I think parents are doing what they can. And parents who are also working during this pandemic, who are our frontline workers, live in our communities, and they've done everything that they can. I think the kids are very starved for fun spaces, first of all, and then secondly, we're concerned for their mental health, and I know the CHIO has talked about this quite a lot. We're seeing admission rates go up. I'm further concerned about people who don't have access to health care, adequate health care, which is a lot of people who live in social housing, and who don't have the ability to have family doctors that they're talking to on a regular basis. So there's a lot of hidden things that I think will come out during our whatever we call the recovery period. And we're also, I'm concerned about the learning loss that has happened. I don't think virtual school is effective for a lot of the children that we serve. And, my office, the community house is directly in the community, and I'm out walking around, and I know kids who should be in virtual school and they're not in virtual school, but can we blame them? We can't blame them. I think kids are really struggling. And our goal this summer, though, is to focus on providing as many opportunities as accessible as possible, as fun as possible, for them to see their friends, hang out in the neighborhood, and just have fun and just create as much physical activity, group physical activity opportunities as possible. So there's quite a lot, and then the other part is we're limited with the amount of group programming we can offer. So what we're thinking about is how do families continue on and get their own individual opportunities for summer activities.
Wow. It's one thing for medical professionals to come on whatever media or Twitter sphere saying their concerns. But yeah, what's powerful for me anyway, Faduma, is that you see it. Like, this is your world. You see the kids out, not in that virtual space, or not doing their virtual learning. You see the impact it's having on their mental health and the concerns for their actual education. I think it's just really important to hear it from somebody that is in it.
Mm-hmm.
Do you know what I mean? Like, I speak from what I see of my own kids and my kids around me, but yeah, this is stuff that you're seeing. And I guess this is maybe a comment more than a question. Part of the thing that makes it so sad for me is that not having that space where they could all get together or have that kind of that community environment. Like, what's your concerns, I guess, that we're not recreating that space in that environment where the kids can be themselves and play and interact with their I want to call them colleagues, but that's not the right word. What's the word I'm looking for? Peers. Thank you. Peers. Yeah.
Peers. Yeah. Well, like, I kind of want to go back because, Kwadwo, and I feel like people have said this before, is our society has always been very bad at addressing the social determinants of health. That's where we should start, because we don't have good community spaces. We don't have easily accessible community spaces that are, you can have 20 people socially distanced still being around. And that the pandemic has shown that full out. And I've seen the government responses around investing it in community spaces. And, it's too little too late a little bit to help us kind of manage some of the impacts of the pandemic. But, we rely on a school facility to see all the kids. We don't have the space to meet the need of what we're seeing, and the schools, have to follow public health guidelines. That's just the reality of it. They're not able to accommodate us and have after school programming from an external partner. So there's a lot of small things within our society that, it's a no-brainer that we're in this mess. So, I think it would be great to think about, as we expand our city, as we think about building new neighborhoods, like, why are we not talking about, a walkable neighborhood that
Yes.
you can have amenities by? Like, it doesn't make sense. And it is unfortunate. And that, like, I hope we learn these lessons. I am, but and I know that there are city responses to this, but it's not fast enough, and it is a real detriment. So we didn't have the community spaces available. Like, that's just the reality of it. And I don't know if we are interested in building new spaces. I mean, I think, I've talked to you about our journey for a space, and that's something we're heavily focused on. And the pandemic has shown that we really need to step on that. And just to say, the school boards and the Ministry of Education has still not given direction on agencies being able to use community spaces over the summer. And that's a question that, we have. A lot of agencies are wondering why that is.
These are very good points. And I think that's one thing COVID has done, is put a lens on where our gaps are in healthcare and in society. And I got to tell you, the more I get involved in my career, those social determinants of health are everything. Like, having that walkable city, having those, community spaces where people can stay active, they could congregate safely at a distance, as you mentioned, is health. Not only physical health, but mental health. It's so important. One thing that I'm thinking, Faduma, is like, we're raising these funds and we want to be able to engage communities like like Brittania. Like, where do you see the benefit, in terms of getting our kids active, or ways we could get our kids active? Where do you, like, I guess the simple question is, will it be helpful raising funds?
Of course it will be helpful. Things cost money, right? Money is the thing that makes our world go around, which is anyways unfortunate, but it is what it is. So what we're doing, and similarly to other community houses and other agencies is we're looking at the guidelines of what we'll be able to offer. So we know the different phases will have different opportunities. There is a lack of direction around summer camp from the province, and what that means. I think there's been just statements but no details, so we're monitoring that. So we're going to be heavily focused on outdoor engagement. So we're just, and right now I think our restrictions are 8 people or 10 people can gather as of July 5th, which is when we hope to start our summer activities. But we have 778 people living in Brittania Woods. And we also have some families who are not comfortable mixing or sending their children out. So we're looking at what kind of activities can we do distance, what kind of areas can we use to do programming. So we'll be purchasing a lot of different things as needed. We need increased staff time to be able to offer more things in smaller cohorts. So it's just a lot of going back and forth. We're working with our local partners. The Boys and Girls Club BGCO is in our area, but they're a bit further out from our neighborhoods. We're exploring how can they be coming in when we're not able to do engagement. What can the city do to step up? So there are people meeting about this. Not a lot of funds to go around. So anything that's raised by, I think, allies and people who are concerned will go to filling the gaps of what we're able to have, and then also, supporting individual families perhaps who want to sign their child up for a specialized something. That's also really important. So I don't know if I've answered the question.
Absolutely.
Yeah, of course.
Faduma, absolutely.
Needed, yeah. Some of the things that we're doing is, because we were in the local school, we don't have a lot of space to hold all of our basketballs, soccer balls, everything. So we were using these schools were generous enough to lend those to us, but that means we now need to build up those resources ourselves. So we have purchased a few things. We're looking at purchasing fun outdoor games. We're looking at admission fees for different things that kids can be able to go to. So there's a lot. We're entering planning mode as of next week.
I hear you, but what I'm hearing though is the funds, either it's to support the staff, equipment, but either way, it's getting kids out of the house, active, giving parents a reprieve, giving kids a time to connect, stay active, get healthy, improve their mental health. This is what it's all about.
Exactly. That's it.
Yeah. So honestly, we're really excited to be doing this fundraiser. Faduma, it's really been a pleasure, and thank you for really mapping out what it's like, what you're seeing at the ground level, and why initiatives like this matter. So thank you so much.
I really appreciate it. Thank you for creating the platform. I really enjoyed being on here.
Absolutely.
And thank you to everyone who's participating in this.
100%. Thank you. And so we'll have links attached below. If you're watching on Facebook, I'll attach them right after we're done this segment. Anyways, Bridges Over Barriers, 5K for 5K. Donate. It's supporting our neighborhoods and our kids in our community, helping them stay active. If you want to be part of this initiative, post your 5K initiative, whether it's biking, it's swimming, whether it's running, walking, skating. I saw one of our members, Ariel, she was doing some, what was she doing?
Roller skating?
Roller skating. I can't think today. Rollerblading. Circa 1998. It was amazing. But yeah, help us change that boogie, guys. This is all about supporting the community. So once again, Faduma, thank you so much. And for the rest of y'all, we'll connect again real soon.